Hello everyone, welcome to sqadia.com, and now we will talk about polycystic ovarian syndrome in the last section of our lecture topic, menstrual cycle and hormonal disorder. We already talked about the physiology of the menstrual cycle in section 1. In section 2, we went over the phases of menstrual cycle in the ovaries. Then we talked about the phases of menstrual cycle in the endometrium of the uterus. Then we talked about thyroid hormone functions and dysfunctions. And then now it's in the fifth section of our lecture, we will talk about polycystic ovarian syndrome. Polycystic ovarian syndrome, as the name shows, it has multiple cysts in the ovaries develop, and that causes multiple problems and different signs and symptoms. So we will talk about the overview of the polycystic ovarian syndrome. What are the different signs and symptoms of polycystic ovarian syndrome and how we should manage this problem. So, overview of polycystic ovarian syndrome. It's a very common hormonal disorder of reproductive age. Reproductive age that starts with menarche around 13 years and that ends with menopause about 50 years. So polycystic ovarian syndrome is very common in the reproductive age around late 20s to 40 years age. It's very common. So hormonal disorders of reproductive age, and what happens in polycystic ovarian syndrome, the menstrual cycle gets very infrequent and prolonged. It occurs after 35, 40 days or sometimes 2, 3, 4 months passes without the regular menstrual cycle. And in the polycystic ovarian syndrome, the male hormone, androgen level is high. It's increased in females, androgen, which is the male hormone. Ovaries develop fluid-filled sacs. If you see here in this diagram, this is the ovary, and there are polycystic. These are the fluid-filled sacs. Cysts are the fluid-filled sacs, and there are fluid-filled sacs in the ovary, so normal ovulation is not taking place, no ovulation. So in polycystic ovarian syndrome, infertility is very common because ovulation is not taking place and ova are not produced by the ovaries, so no fertilization, no conception. And since cycles are very irregular, for conception to take place, regular cycles, regular ovulation on 14th day of the cycle is very, very important. So in polycystic syndrome, all that is not happening. So all the cycles are not very regular, infrequent, and prolonged. Signs and symptoms, polycystic ovarian syndrome, if this is the hirsutism, female with the hair growth like the men, mustache, acne, all these are very common because of the high levels of androgen in the polycystic ovarian syndrome. Sometimes patient doesn't have very clear signs and symptoms, but in most of the cases, hirsutism and this hair growth is so common that when the patient walks in the office, you just by looking at the face of the patient, you can tell this person has polycystic ovarian syndrome. And most commonly, the patient, they seek the help of the doctor because of the infertility they have, because of irregular and infrequent menstrual cycle, no ovulation. So excess level of male hormone causes all these changes, which is the weight gain, hair pattern, hair growth like the male type pattern, baldness, hirsutism. All these are very common. There are Other features like anxiety, depression because of the hormonal imbalance, because of infertility, and there is high blood pressure and high blood sugar in the polycystic ovarian syndrome also. Now, management of polycystic ovarian syndrome, management of symptoms causing problems is the first priority. Any symptom that's causing problem, we should treat that symptom. Then lifestyle changes, diet control, exercise is very important to reduce the weight. Once the weight is controlled, sometimes the cycles get regular, ovulation takes place, and conception can occur in some cases. So lifestyle changes are very important. Then the other drugs, medical treatment of polycystic ovarian syndrome is metformin. Metformin doesn't have anything directly to affect polycystic ovarian syndrome, but because of high, we said there is high blood glucose level. So in this patient, most of the time with polycystic ovarian syndrome, patients have insulin resistance. Insulin is not affecting the cells. There is resistance to insulin, so blood glucose level rises. To control that in turn causes the insulin resistance, causes increased production of androgen hormone. To control that, this metformin is used, which lowers the blood glucose level and decreases the insulin resistance. Then spironolactone, again, this is used for mainly for blood pressure use. It's a diuretic, but in polycystic ovarian syndrome, spironolactone is used again to lower the level of androgen, which once reduced decreases the symptoms or severity of polycystic ovarian syndrome. Oral contraceptives are very effective in oral polycystic ovarian syndrome to regulate the menstrual cycles and to bring the hormonal imbalances to normal. Then clomiphene citrate is used for ovulation in females who have infertility. We can try clomiphene in polycystic ovarian syndrome to help them ovulate and help them conceive also. So all these are the drugs we can try to reduce the severity of the symptoms, but the main problem females come with is the infertility problem, and that infertility is mainly due to the lack of ovulation that's not taking place in the polycystic syndrome. Here you can see in the ovaries there are multiple cysts. All those cysts can prevent the normal ovulation to take place. So in this section we talked about polycystic ovarian syndrome, what are some signs and symptoms of ovarian syndrome and polycystic ovarian syndrome, and how we can manage it and how we can treat the infertility associated with this and other disorders. Thank you for watching sqadia.com.